Hello, and welcome to the Fertility Center of Las Vegas for your GC screening visit. I am Dr. Carrie Bedient. I am one of the three physicians here at the Fertility Center of Las Vegas. My partners are Dr. Bruce Shapiro and Dr. Leah Kay. You may see all of us during the course of your time here with us, not necessarily today, but over your whole journey. And I wanted to walk you through this process, starting with everything that we are going to be doing today. This video takes maybe 15-ish minutes. I'm going to try and break it up in a way that is easy to digest, but starting with the things that we're going to do today. Today is really easy. We're going to go through your medical history. You already know the answers to all of these questions. We're going to do a physical exam. This is going to include a breast exam and a pelvic exam, as well as listening to heart and lungs and kind of all the things that you're used to at your doctor's visits. After we do the physical exam, the next step will be to do what's called a saline ultrasound or a sonohysterogram, or to do a hysteroscopy. And so in some cases, this depends on the big picture. For a saline ultrasound, you lay back, put your feet up in the stirrups, we put the speculum in, and then we pass a very thin catheter through in order to put a little bit of saline, which is salt water, into your uterus. We do a vaginal ultrasound, take a look around, make sure there's no polyps or fibroids, nothing that's going to interfere with the baby implanting, and then we're done. For most women who've had babies before, this really isn't too bad at all. There's very little that we can do to you that's more obnoxious than what your children have done to you. And so hopefully this is pretty quick and easy. For doing hysteroscopy, what we do is after you have gone through the visit and we're ready for that part of it, we will have you again lay back, put your feet up, and then put the speculum in, and then pass a very thin camera through and take a look around. What we are looking for is not only polyps and fibroids, so things that can impair the implantation again, but also endometritis, which is an inflammation of the lining of the uterus. Because when we see that, we want to give you some extra antibiotics to clear it up so that you've got an even better chance of conceiving on the first time through. All of those things are fairly straightforward. If you need some Advil, ibuprofen, NSAIDs afterwards to help with cramping, please let us know. And also things that would help a bad period can very much help there. So if you need heat, anything like that, that can really help any cramping that you might have. But like I said, most GCs tend to do really well with this because you've had children. And so they're far more involved in causing drama than anything that we do. Next thing that we're going to talk about is the doctors here. And this is really the medical clearance process. After we go through all of our visit today, we are going to do medical clearance. So we've already gone through your medical records, making sure that we have everything about your prior deliveries, make sure that there's nothing that we need to be concerned about there. And it takes about 3 weeks or so to get all of the labs back that we are ordering today. Once we get those labs back and we see that they're good, then we'll move on to the legal clearance. Now, things that most often catch us up in the medical clearance process, number one is a low vitamin D. Pretty much everybody has a low vitamin D. It's very, very common. And so we have you take some supplementation to help bring it up. It's also very common to have anemia, and iron supplementation can help you with that. Other things that are common, thyroid is very common. Occasionally someone will have an elevated blood sugar, but we're looking to make sure that these labs all look good before you get the final clearance, because we want to know that both you and baby are going to be as healthy as possible going through this process. Sometimes people will need a little bit of extra uterine imaging, by which I mean a mock cycle where we give medications and watch the lining of the uterus. Sometimes you'll need an extra ultrasound. But before you go today, we'll be able to tell you if any of those things apply to you, especially with respect to uterine imaging. The labs, again, those take a couple weeks, usually 3 weeks or so. Next thing we talk about is the legal clearance process. Once you've gone all the way through medical clearance, you're going to go through legal clearance. This is when you and your IPs and lawyers for both of you make sure that all of the terms of the agreement are set and ready to go. So a lot of this is the financial discussion. The part that's more important to us is all of the things that you do during pregnancy. So think about nutrition and exercise. Think about if you have any hobbies or a job that could impact a pregnancy. Think about what kind of delivery you might want to have and where. The third trimester is really not the time to find out that you really want a home delivery and your IPs really want you to be in the best NICU in town. So discussing all of that. One of the biggest, most important things about the legal clearance process is making sure that you and your IPs have had plenty of conversations about the possibility of a termination of pregnancy. So abortions are very rare in needing to occur after we've done genetic testing and have gone through all this process. But there is always the possibility that something can happen. Even when we have the best tested embryos and the healthiest GCs and everything looks good, there are things that don't exist at the time we do that genetic testing. The heart is a great example of this. We can't test for heart defects because there's no heart at the time that the embryo is transferred. So making sure that you and your intended parents have very clear discussions about what you would and would not terminate for, and everything surrounding that is extraordinarily important. All right, let's talk about the medications and the lining and what happens next. Once you have both medical and legal clearance, we're going to get you started on medications. So when you start your period, you are going to let us know. Oftentimes we're helping you manipulate that with birth control pills so that as soon as that legal clearance is done, we can get you a schedule and get going. Once you stop your pills, if you're on them, you'll get your period. And then a couple days later, we will have you go in for your baseline set of labs and ultrasounds. Everything we do are vaginal ultrasounds in order to get the best look at the lining. Most of the time, these were going to occur close to home for you. You don't have to be in Las Vegas for this. And so we do ask if you can snap a picture of the lining of the uterus. It's super helpful because that way, if your monitoring clinic is a little bit late in getting us labs or a report, we still have that video or that photo to look at. And there's a lot that we can figure out just from a photo. So you get your basic labs and ultrasound at your baseline. If everything looks good, we're going to start you off on estrogen. This is done with pills and usually with patches. Sometimes we add in vaginal as well. It just depends on what your body needs. Once we have the estrogen started, about a week to a week and a half later, we're going to check another set of labs and ultrasounds to make sure that the lining is thickening up as it should be. Some people are going to be ready at this first check. Most others are going to take at least one, if not a couple more. When we see that the lining is thick and has a special appearance that we're looking for and the labs look good, we're going to have you start your progesterone injections. Now, these are shots in the backside. They are literally a pain in the butt, but they do their job very, very effectively, which is why we use them. So you're going to start those injections, and about 5 to 6 days later, you're going to come back to Las Vegas and we're going to do the transfer. We'll do another couple sets of labs and ultrasounds in here, especially the day of the transfer. We want to make sure that everything looks good. Then our lab is going to thaw the embryo. So you're going to come in early that morning and we're going to thaw the embryo once we know your stuff is good. You're going to have the morning to yourself. And then early afternoon generally is when you're going to come back for the actual transfer. The transfer is very anticlimactic. I mean, you've been through all the stuff to get there and you lay back and put your feet up. We put the speculum in, clean things off, and then pass the guide catheter through and then pass the embryo through. You do have a full bladder during this. This is because we're going to be doing an abdominal ultrasound in order to see the lining of the uterus. We put it back and we're done. It's fairly quick and fairly easy most of the time. Once you are done with that, you are going to continue all of your medications. You don't have to be on any special or crazy bed rest. Nothing wild and crazy. So we do tell you no sex, no gym from the time that you start meds until you get the first heartbeat. That's not really because we think that anything is going to happen in that. It's mostly because it's the most tenuous time, and we want to make sure that we're being safe during that. You are going to continue these meds through about 10 weeks of pregnancy, and then at that point, you will come off of them and go back to your regular OBGYN. After your transfer, once you go back home, all of the rest of the monitoring can occur at your monitoring clinic. So again, you don't really have to come back to Las Vegas except for the transfer itself. Okay, next, expecting the unexpected. So these are the potential risks in this process. Now, there's the risk of medications. This is true of any time you have high hormone levels, no matter what the reason, whether that's medications or just pregnancy itself. There's the risk of blood clot and stroke, which are the highest ones. typically less than 1%, but possible. So we talk about them. There's nausea, breast tenderness, feeling hormonal, mood swings, all of those things, i.e. pregnancy. There's the risk of the transfer. That's very low. It's of infection. We give you antibiotics after it, just like we do today, to make sure that that stays a very minimal risk. But really, the biggest risk is of pregnancy itself, because every pregnancy is different. And so some that look totally calm may be impacted later by diabetes or high blood pressure or preeclampsia. Sometimes they will be impacted by procedures like a D&C after a miscarriage or a placenta that sticks, needing a C-section if kid's not behaving, or needing a hysterectomy if kid and uterus really aren't behaving. Sometimes you'll need additional monitoring, and that can be done by local docs in your area in combination with us. So anything and everything is possible, including and up to death. Now, if we thought you were more likely for that, we would say thank you, but no thank you. However, it's always possible. And so we always talk about it because it's an important risk to know of in this process. Now, GCs are selected because they tend to be pretty healthy. They tend to have pretty good pregnancies, and they tend to be pretty low risk, which is why you're going through this process in the first place. Now, there's an extra set of screening that occurs for anyone who's carrying an embryo that is not from themselves or their own intimate partner. And this is called FDA screening. FDA screening is done for any kind of organ or cell donation. And so some of these things are very applicable to if you're getting a heart or a kidney donated to you, but they're less relevant if you're getting an embryo. But we follow the rules. We go through exactly what we're supposed to because we want to make sure that we are catching absolutely everything. With the FDA screening, the intended parents, the egg donor, the sperm donor, whomever is involved in giving those eggs and sperm and making the embryo has to go through higher level screening. And so it's a special set of labs on top of the original ones. It's a physical exam. It's a very extensive questionnaire. Now, each individual embryo's FDA papers are going to be different based on who's giving those eggs and sperm. I am going to talk about a couple of the most common things that we see. Now, the doc doing your medical clearance today will walk you through the specifics for the embryos that you are going to be getting, okay? CMV is the first one we're going to talk about, and this stands for cytomegalovirus. It's a big, impressive name. This is very relevant because when you are getting an organ donation, if you don't have an immune system, which is they have to knock out the immune system in order to transplant a kidney or a heart or a lung or something like that, if you've got CMV, it can potentially make you very, very sick. And so that's why this test is on the screening. Now, that's very relevant for getting an organ donated. It is less relevant for an embryo because you have a fully intact immune system. And you want to know what CMV causes? It's pretty much a cold. And so let's say that you get CMV from your transfer, you'd get a cold. And it tends to be a very minimal deal for GCs who are going through this. Now, the other reason that we check this is because if the baby is affected, we worry about the possibility of birth defects in the baby. Now, I say all that, but listen close because this part's important. There have been no reported cases that we are aware of somebody getting CMV from an embryo transfer, either baby or gestational carrier. And so that's really important to know. In all of this, it is much riskier if you are driving in the city of Las Vegas than it is of getting CMV and worrying about that. Because again, cytomegalovirus is a cold. The other thing that we see very commonly come up is for patients for the intended parents who live in Europe. There are a couple of special conditions, CJD, Creutzfeldt-Jakob disease, and Zika virus. These are ones that we see come up more often. Now, again, these are very rare, and we don't know of anybody who's had them passed along to them through an embryo, but it's theoretically possible, so we talk about it. The likelihood of those things happening is extraordinarily low, but we talk about them because we follow the rules. And again, really the risk that you're taking in all of this is of pregnancy and getting in the car, no matter where you live. Those risks of driving, of being pregnant are the more likely to happen ones just because you do them all the time. The CMV, the CJD, Creutzfeldt-Jakob disease, the Zika virus, all of those things are theoretically possible, and so we go through them, but they're not the risks that are actually most likely to happen, which are things that you're probably already okay with because you're here and you probably got in a car to get here and you're planning on pregnancy and you've been there, done that before. So wanted to go through all of that with you. Please ask any questions that you have of the doc that you're talking to today. We very much want to know that you are comfortable and that you have your questions answered. Our staff has been doing this a long time. Feel free to ask them questions too. If they don't know the answer, our offices are just right down the hall from them, and they never hesitate to come in and ask us anything they need at all. So I hope that your visit today goes very smoothly. I am so glad you're here. I am very proud of you for doing this. This is a big deal and it's a big process. And I hope you have a wonderful journey and your doc will be in soon to help get all this started. All right. Have a wonderful day. Safe trip home, especially if you're traveling from a bigger distance.